Hello, I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center, and we're going to be reporting on case 01946. The case history was seizures. And so seizure activity is normally, in most cases, considered an epileptic event, so a neuromuscular event, but it can be triggered by other things in the body as well. But usually driven by sensory response to the pituitary and pineal gland, which can trigger outgoing activity to the body. So the classic epileptic events can be mostly skeletal muscle. Fortunately, we don't see smooth muscle affected or heart muscle affected because that could be more serious. But in looking at the underlying cause, we want to get to the molecular level. And so the base point reading, we see that there's three areas. Red is weakened, green is balanced, and then yellow is stressed here. So when we see red, that's a warning signal, but not necessarily a serious or terminal problem. It just says that that's where we really want to focus in on. And the main area is going to be with the lymphatics, the endocrine system, and intestinal tract. And so endocrine system, just like I mentioned earlier, the sensory information by the pituitary and pineal receiving information, the adrenal gland accepting that information and then reporting that to the rest of the body, indicates whether there should be a standard fight or flight response or should the body relax and stand down. And with seizure activity, the body's always on a heightened awareness, and then one thing can be the tipping point to set that seizure off. And so when we correct this and rebalance it, we put this patient into a better situation to resolve that seizure activity on their own by using its own body to repair itself and recover, versus being on traditional medications like phenobarbital, potassium bromide, etc. So, and also taking a look at the holding report, we see that, and this is divided by groups and then subgroups. So we do see a group called food, and then we get into the subgroups of that food. We see vegetables, we see meat, and as we scroll down a little bit further into that category, we see additives. And so as we break it down a little further, what additives? And sensitivities mean that if we're being exposed currently to these additives, could set off a response. In this case, could it be setting off seizures or some other inflammation? And so we want to review the diet to make sure that the current dog food does not contain these ingredients. Also, if we are feeding from the table or an accidental morsel, did that food contain some of these additives? Because in general, dogs that have additive sensitivities have a tendency to have issues with processing. And processed dog food, basically, dry dog food is the most processed because it's designed to last the longest without spoilage, on average about 18 months in a bag before it spoils, where canned food has been sterilized in the can, so longer shelf life, and then all the way down to unprocessed food. So the less processing, the better when we're dealing with seizures, because that can trigger excess brain activity that can set off this epileptic event. The other thing that we had in the meat category is that we were sensitive to rabbit, beef, and bacon. And those, rabbit's not going to be a common one that we would feed, but beef is, so we want to make sure that we're staying away from beef. Bacon usually dog foods don't have bacon, but there's bacon flavorings in treats, or even giving them a piece of bacon with the Sunday morning breakfast, for example. Those things could set off neurologic activity. And then finally, vegetables. There's a long list, so I won't go into detail about each individual vegetable, so make sure that when you do look at your list, to make sure that we're not receiving these. But vegetables are usually provided in some of the more holistic diets these days, and processed dog foods, all the way up to the owners feeding a little bit of vegetable with the diet. So if we're receiving any of these at all, sensitivities can set off inflammation, so we want to avoid those. If we're not exposed to these, great, but now you have a list of what could be, and so that'll be important in managing epileptic events. In the meantime, what we're going to do for our conditioning is we're going to use a hemp oil infusion, 3 drops a day for 3 months. That's going to condition and bring back these numbers back into balance. So in 3 months, we're going to see these numbers looking better. The ones that are balanced may be in transition, so we want to see if those have switched, because the ideal scene is they all come back green, but it's not always the case, especially when we're first conditioning dogs back to health and recovery. And so we'll retest in 3 months. In the meantime, we're going to be controlling the events as naturally as we can. A product like Detentang is a natural anticonvulsant that can be used in conjunction with the body to control neurologic events. And we try to reduce the potential for being on phenobarbital or potassium bromide as much as possible, because they do have side effects, and there's a lot more management and maintenance when they're on these particular medications. So please, if you have any questions, give us a call at the clinic, 847-802, 847-541-4005, and give us a call if you have any questions. We can set up a consultation. Thank you.